In September of 2009, the Department of Justice launched the Cures Prescription Drug Monitoring Program, which is currently housed in the Department of Justice. California was actually the first state to implement a prescription drug monitoring program, paper-based, of all 50 states. In the 2009 Cures program was an attempt to automate and allow for electronic filing of information by pharmacies. Cures is a state database of dispensed prescription drugs that have a potential for misuse, abuse, and addiction. Cures provides for electronic transmission of specified prescription data to the DOJ by pharmacists in the state on a regular basis. Pre-registered users, including licensed healthcare prescribers eligible to prescribe and pharmacists authorized to dispense controlled substances, law enforcement and regulatory boards, including the medical board, access patient-specific controlled substance history through a secure website. Since the launch of Cures, the board has utilized these reports as a very valuable tool throughout the investigative process. As part of our intake or triage review of new complaints received in the Central Complaint Unit when there's an allegation of excessive or inappropriate prescribing, the prescriber history report is generated from Cures. The report provides the board with information on the quantity of prescriptions written by the physician, which are then referred to a medical expert for review. Medical expert reviews the report to determine whether the quantity of medication being prescribed is either appropriate or excessive, and a field initiation can be initiated as a result. The medical expert also helps focus on specific patients who may be receiving a concerning amount or combination of controlled substances, as these patients generally do not complain to the board. The board's Central Complaint Unit also utilizes Cures to evaluate complaints related to care being provided to specific patients when the complaint is made by a family and the patient refuses to provide an authorization for release of records. A patient activity report is generated to identify whether the patient's getting drugs from multiple prescribers or from multiple pharmacies. If it's deemed to be an issue, again, we would subpoena the medical records and authorization for release from all prescribers or providers caring for the patient. When a case alleging inappropriate prescribing is sent from the Central Complaint Unit to the field, the investigators utilize the Cures report for a variety of purposes. Typically, the investigator will run a report that lists all patients for whom a physician is prescribing. They will look for patients for signals of problems, such as patients who reside far away from the physician's office or from the pharmacy where the prescriptions are being filled. Patients using a variety of pharmacies to fill prescriptions do this to avoid detection by pharmacy personnel. Numerous people with the same surname receiving scheduled drugs from the same physician, and a combination of drugs being prescribed, as well as the age of the patient. Once a sampling of patients who fit an aberrant prescribing pattern is identified, the investigator then runs the patient Cures report to again learn all of the prescribers writing the scheduled drugs for the patient. Investigators thus acquire information about a determination about whether or not the prescribing is within or outside the standard of care. Investigators have also found the Cures report very important for cases alleging self-prescribing or physician impairment. The Cures report is run for individual physicians to determine, again, if they're receiving a concerning amount of prescriptions and from whom and how often. It's important to note that the Cures report does not stand alone as an investigative tool. It's a roadmap that leads the investigator to the evidence necessary for prosecution. The board also uses the data to monitor physicians placed on probation following disciplinary action. A common condition of probation ordered for inappropriate prescribing is a limit on or restriction from prescribing controlled substances that a physician can prescribe. For example, a physician may be prohibited from prescribing Schedule II or Schedule II and III drugs during the period of probation. The probation unit will generate a report from Cures showing the physician's prescribing history to ensure compliance with probation. And again, a patient activity report to ensure the physicians are not receiving or writing prescriptions in violation of their probation. Cures is a critical enforcement tool. The system needs a stable source of sufficient funding to enable it to be upgraded, to provide real-time, rapid turnaround for inquiries, and to build the capacity to enroll and handle inquiries from all prescribers in California. I know the committees are aware that there is a single individual in the Department of Justice, a heroic individual, Mr. Mike Small, who is maintaining the Cures database and who single-handedly is enrolling people who are applying and spending a fair amount of time. He estimates 3 hours a day helping those who are actually approved to use the system to navigate some of the antiquated means by which prescribers are kicked out of the system in the process of trying to make an inquiry. As valuable as this tool is, currently about 8% of physicians in California have registered to be users, and only 6% of pharmacists. And the waiting time for enrollment as a user can be substantial. We heard testimony at the forum from a physician who had applied in July of 2012 and who has still not been enrolled into the system. The board has been and continues to be very supportive of efforts to identify a stable funding source for Cures, and is eager to work with the interested parties to identify and reach agreement on a funding source that will enable Cures to function optimally, to allow broader use of it, and again, to make it stable. I want to